the
Hello.
Yes, Doctor.
Assalamu alaikum.
Waalaikum assalam warahmatullahi wabarakatuh.
How are you?
Alhamdulillah. Alhamdulillah, fine.
Alhamdulillah, that's good. MashaAllah. How many participants now? All?
All 9 participants. All are here.
Okay, that's good. Let us start by Kitab. So today we have 2 long cases. Okay. Hello.
Yes, Doctor.
Yes, Doctor.
We have 2.
Okay. Do you have anything from the previous session?
Anything?
Pardon?
Any remaining thing from our previous session or not?
I think no.
Okay. So let us start by the first long case, please. We need 20 to 25 minutes, please. Okay.
Doctor, I will be presenting the long case.
Can you, your voice, please? Raise your voice.
I will be presenting the long case.
You will be presenting the long case. Okay, what case is it?
Tetralogy of Fallot.
Also, you have the history.
Yes. I cut that before the MCO period.
Okay, so now you will be a role player now as a mom.
Oh.
And I will assign another one
Okay.
to ask you about the history for about 20 minutes.
Oh, okay.
And at the end of 20, maximum 20 plus minutes, you will tell him, sorry, I am busy. Okay?
Okay.
So who can raise his hand to be the one who collect the history from a nice mom? Hello?
Yes.
If no one raises his hand, I will assign. I have a very nice case now. Tetralogy of Fallot. Who need to be the one who got the history in front of us by English language? Okay, I will choose, or anyone need to raise his hand? Okay, Noor Hafiza.
Okay.
Noor Hafiza.
Yes, doctor.
Yes,
Hello?
please.
Okay.
Yes, you have one patient. You have one mom now. I need you to collect history. She has a patient with cardiac condition.
Okay.
Okay.
Assalamualaikum, Commander.
Yes, you can start now.
So,
introduce yourself, good permission, and do the job as if in the actual situation.
Okay. I'm Hafiza, third year medical student from UAE. May I ask you questions about your children?
You can raise your voice, please.
Okay. Hello? Okay. Is it okay?
Okay. I brought my child last night because he had like worsening bluish discoloration. So I brought him to the ED last night.
May I know is how old is he or she?
He
How old is he?
is 8 months old.
So what happened actually last night? Can you describe?
Actually, my son had a fever before last night. But the fever just intermittent.
How
Then
many days
last night,
is it already?
for 2 days.
2 days. Okay.
Then suddenly last night, the bluish, the palms and the soles of my son suddenly become more bluish lah. From before. From before.
From before means that before last night it's already bluish.
Yes, but it is like worsened last night. And
When was the first time you noticed that there is bluish discoloration of the palm and sole?
I think from the first, he had this condition. He was diagnosed with cardiac condition from the after his birth.
Where was it? Where did he born?
Sorry,
Where did he born?
where?
Where? HTA or
Oh,
IMM?
HTA, I think.
Okay. So so last night did you is it the palms and soles are cold? Or they cold?
Oh yes, yes. It is really cool.
Um the fever worsened last night or it's just the same for the past 2 days?
Like it's the same. The bluish discoloration it is like worsen when he was feeding breast milk.
Um uh, did he did he cry during when he turned blue?
Yes.
Is there did you notice any sweating
No,
in
no,
your baby? No sweating.
no.
Mm, um, I want to ask about the feeding.
Okay.
Is it good or uh, is he fully breastfeed or take formula milk?
Fully breastfeed.
Fully breastfeed.
Uh,
Is the cycling good or did he
yes.
always stop for?
No, there was no like interrupted feeding.
Is this the first time he appeared like this?
This is first time I brought him to the hospital because of the worsening bleach discoloration.
May I ask about the fever?
Yes.
What do you mean by intermittent fever? What do you mean by intermittent fever? Just now you said that he had intermittent fever, right? So, what do you
Yes.
mean by that?
I give the paracetamol and the medication. It resolved, but only for a certain period lah, and then it come back.
So,
Before the fever, he had sick. I think he infected from his brother. He had sick contact with his brother.
did he had any cough, runny nose?
There is no cough, but there is runny nose and some same with the fever at the onset fever.
Do during he was breastfeed, when when you notice that he turns bluish, you notice that he becomes breathless, like he was gasping for air.
I noticed that he like hyperventilate, the respiratory rate increase.
So he stopped breastfeeding for to grasp grasp for air, is it?
Mm. Mm-hmm. Mm-hmm.
Before this, there's no period of interrupted feeding, right?
Yes.
Okay.
The feeding was okay.
So I want to ask about he had congenital heart defect when he was born.
Mm.
Mm.
Mm-hmm.
Can you elaborate, explain how, what is it? What does the doctor say?
The congenital heart disease, the heart problem. The doctor said that my son had heart problem because there was murmur like sound, heart sound, abnormal heart sound after the birth, and also he appeared sinus after the birth lah. And he was admitted to the NICU after the birth, and he is under follow up in klinik kesihatan. I'm sorry, in PITS clinic PCA. And he had medication lah from the doctor.
Do you remember the name of the medication?
Propranolol. Actually, I will have an appointment with the IJN, the National Heart Institute, but tak pergi lagi. Not go there yet.
Because of the MCO, is it?
Yeah. Before.
Okay. May I ask about the the birth history? Is it do you have any when you were pregnant? Is there did doctor said there's any abnormality of the baby when doing scan, or do you have any do you have any uh,
There's no problem.
are you healthy? You're healthy lah throughout the pregnancy.
Yes.
Okay.
Yes.
Is the baby born full term or preterm?
The baby born 3 days after the due date.
3 days after delivery. Preterm. Via normal delivery or
Yes,
cesarean?
normal delivery.
Is there any complication after the delivery?
No.
Mm,
The birth weight is 3.2 kg.
okay. 73.
Yes.
Did he have any siblings?
Yes, he has two older siblings. The first one is 5 years old and had autism. And the second one is 3 years old.
Is it boy or girl?
Both are boy.
Um, Apart from the heart problem,
Yes.
Is there any other problem where during after he was born? Like may I ask about the development of the children?
Yes.
And is it appropriate with his age?
I think yes.
So he can already sit by himself.
Yes, he can crawl.
So he if according to his age, it's same as the second brother.
Yes.
Um, apart from he turned bluish when he was born,
Mm.
and until now, is there and is there any episode of bluish discoloration?
The bluish discoloration can be worsened during crying if the patient is crying, but it can resolve spontaneously.
Is
But
it frequent? How frequent is it frequent?
I'm not sure about that.
So is it every time he cry or um just like once a month or
But I think not so frequent.
it's a frequent? So not every time he cry lah.
Hmm.
May I know the what is the weight of the baby now?
Now, 7 kilogram. I think.
7 kilogram, 8 months, right?
Yeah.
Okay.
The immunization all complete.
Thank you. Did he develop any rashes after taking vaccine?
No.
Remaining 1 minute. ask any question?
Yes. I want to ask about the eldest rider who has autism. So, when was it? When was he diagnosed with autism?
I don't know.
3 years.
3 years old.
3 years old. Oh, is there any other family members from maternal side or paternal side who have height problem?
No.
Heart problem. Is there anyone who is different from other people? Like, is there any family members with Down syndrome or autism?
Oh, no. Oh, autism, just his older brother.
Yes. Okay.
Okay, terima kasih. So, Nur Husna,
Yes.
can you tell us the diagnosis?
The hypercyanotic spells is underlying pathology of headache.
Yes, hypercyanotic spells secondary to, okay, the Abir. Abir, your colleague, her name is Abir. Hidayati and Hafiza, sorry. Hafiza?
Is it there?
Hafiza?
Yes.
She said her diagnosis is fellow tetralogy with hypercyanotic spells. Do you have any other differential diagnosis? Because this is the first time, yes?
First time.
I think it's for the it may be a respiratory cause, which is a respiratory infection because the child the baby is having a fever and runny nose before the onset.
Very good. So it can be a respiratory problem, either pneumonia, either infection, upper or lower respiratory tract infection. Okay. Do you know that even congenital heart is more susceptible for chest infection? You must read why that. Okay. What else? Any patient which turn its cyanosis, it can be either heart or chest. Okay. Or
Neurology.
like something central.
Seizure.
Yes, like seizure, like apnea, like any central apnea, central seizures. Sometimes they can affect, so we must rule out any CNS problem also. Okay. And for just for your knowledge, you know that our lung and heart both can cause cyanosis, but there is something in between them, which is the vessels. So if we got something known as pulmonary hypertension, it can cause some diagnosis known as PPHN, persistent pulmonary hypertension. Okay. So it can be lung, it can be heart, it can be vascular, it can be CNS problem. What else it can be? Away from the cardiac, because there is polycythemia. Yes, congenital heart disease is eligible to get polycythemia because of decreased oxygen, hypoxia, so the bone marrow make more hemoglobin. But there is something simple occur in infants. Usually they will turn it cyanosis for reaction of anything. They need to feed, they are angry, a bit angry, known as
This is
what
PD?
is, no,
No.
no. It is known as breath holding syndrome.
Mm.
That's to say, if the baby became upset for anything, he will stop breathing until he turns cyanosed. Okay? And really, if the mother or the family are running and make expression that they are very afraid, it may be the baby will repeat it. We don't know how. So we just teach the family how to be stable and try to handle the situation for this breath holding syndrome. Some of this breath holding turned yellow and some turned blue. And I think sometimes just need to do full blood count to rule out anemia because it can increase the attack. Okay, but it is self-resolving. Okay. So what investigation we are going to consider now, Hidayati?
Sorry, Doctor.
Investigations.
SpO2. Sorry, the pulse oximetry.
Okay, so a bedside test, which is pulse oximeter. Yes, what else?
Chest X-ray, because the patient has symptoms of respiratory tract infection.
Okay, so can be chest infection, pneumonia, or like that, or can be cardiac.
Oh, yes.
So what did you suspect to find in this chest X-ray if he has fallow tetralogy?
He had boot sign.
Boot shape.
Yes.
Boot shape.
Okay, boot sign, boot shape. It is, what does it mean? Yeah, Azri?
Boot shape. Due to our pulmonary stenosis and also aorta override. So
Okay.
it will compress the pulmonary. It will looks like it compress the pulmonary stenosis, and also due to right ventricular hypertrophy, so it will looks like boot shape.
Boot shape. So you must be able to see why the shape of the boot coming. So you need to just assign where is which part, which chamber of the heart is there. Okay.
Oh, okay.
Really, this is the final.
Okay.
Anyone else know abnormal shape in the congenital heart disease? Husna? If you have congenital heart disease, the X-ray can help us. Usually, if you found any patient who is delivered with possible congenital heart disease, you need to do chest X-ray, you need to do ECG, you need to do four-limb blood pressure, you need to do pulse oximeter as your colleague informed. But I'm asking now, any abnormal shape other than boot shape? I will make it. Yes. What is this?
The transposition of great arteries.
TGA. So what is the shape?
The 8. egg on side appearance. Like
Egg
this.
inside, or some said egg and the threads, because the mediastinum will be narrow. Okay, very good. What other shape did we suspect? There is like H-shaped heart. You must go through the X-ray for abnormal cardiac. But most important also to know that cardiomegaly can be one sign of heart. So cardiothoracic ratio is very important. How big is the heart? Usually in neonates, we can accept until 0.6. Okay, but after that, it will be only 0.5. So we got an important lesson now. Okay, number one, how to be systematized. If I'm going to do any job related to medicine, I must be systematized. I will know. Now I am going to get history, so I know what is the history component. 1, 2, 3, 4, 5, 6, like that. So I will not forget. Okay. I must have a flow. Flow, I means I can enumerate my action from 1 to 10, from 1 to 12, whatever is it. Okay. If I'm going it for clinical examination, I know what I'm going to do. Okay. Of course, she asked, but bit late, about any abnormal facial features, and Hafiza asked by a soft touch. It is good. Is there any abnormality in his shape other than the other kids? Why this question is important?
Suspect syndromic features.
Very good. So we are 10 candidate. Everyone can tell me one syndrome, please. And if he's able to say what is the suspected cardiac abnormalities. Okay, you will open your book now. Khairia, Lina.
Down syndrome, Doctor.
Okay, Down syndrome.
Patient have patent ductus arteriosus.
Down syndrome, is it the most common? Patent ductus? Okay,
Yes.
let because this is our first session. We are still in year 3. Let us sit Down syndrome. Okay, what other syndrome? Okay, if you found someone who is a lady, he is a short and has webbed neck and wide spaced nipple and the congenital heart disease with aortic problem.
Turner syndrome.
Turner syndrome, yes. But if you find someone who is tall and wearing glass and has a very long fingers,
Marfan syndrome. Marfan syndrome.
Marfan syndrome, yes. This is number 3. What is number 4? We have a lot. Small baby just delivered and has clenching of his hand and small chest and his foot also doing like rocker bottom and the congenital heart. So it is Edwards, which is trisomy 18, trisomy 13. So now you must go through an important table. It is present in Nelson and in most of the book. What is the congenital anomaly and what is the congenital heart disease most probably suspected? Okay. This is another important point, because if you didn't notice that the patient has a problem and you concentrate in the heart, you are doing part only of your job, not all your job. But as a doctor, we cannot do our job. We must do it completely full. Okay. Now, let us ask about hypercyanotic spills. What is hypercyanotic spills? And why it happens? And how can we manage it? And what is our role of educating the mother now? This is her first experience, and of course, she is very panic and afraid. Her kid can anytime deteriorated, and she cannot do anything for him. So how can we teach her? And I need you to start your medical practice by concentrating on that. You will read through the books by a lot of medical terminology, but you need at the end to speak to the family by a simple lay language. So you will be near to the family. You are able to let them understand the problem and know what is their role. Okay? So it is very important also to concentrate that. Any one of you can answer?
Educate the mother if the child is crying. Put it in like bending the legs to the chest.
Yes. What is the name of this one? Knee
Squat.
chest. Yeah, knee chest position or squatting position. It is knee chest. If he's young, just put the knee to the chest. If he is a bit elder, why you are doing that?
To increase pulmonary blood flow.
Increase. Why? How can we increase the pulmonary blood flow by that mechanism?
Doctor, is it to increase the peripheral resistance?
Yes, very good. So I am increasing the peripheral resistance to allow redistribution of the blood to the other circulation. Very good. Also, this patient may need sedation like morphine. Is very important. Okay. And may need oxygen, but take care because hypercyanotic spills sometimes is very severe and they can be life-threatening. Okay. So that is the most important point. If you hear something new in medicine, Alhamdulillah, now all of you have internet and you have access to the kulliyah. You can open our library. We have a lot of webs. You can go through it up to date, whatever, 100 and 1,000 of that. You just go to up to date and try to read something brief in that. Okay. If it is in your book, which you are reading, it is okay, but sometimes you need to add some points. If you start like that, so you are building your future. Every day, if you are adding for your mental rehearsal, 1, 2, 3, 4, 5 patient and more details about every patient, so you will be clever at the end. You will not be just a doctor, but you will be clever doctor. Okay. So please, I need you to go through that fellow and all the point which we asked to discuss. Anyone did OSCE? Hello?
No, doctor. We thought we only need to prepare 2 cases.
No, I asked to prepare OSCE. Any patient presented to me, because we are not it started to go to the hospital, you must do OSCE. So at least, please, you need to do some OSCE pictures about the shape or abnormal shape of the patient has dysmorphism like Down syndrome or other as a clue for congenital heart disease through dysmorphism. Number 2, you need to do one X-ray or few X-ray about the abnormal shape of the heart. Number 3, you need to give the picture of the baby with hypercyanotic spills and the position which we need to give it to him. Okay, all this must be done by you, and I need one copy of it. You can send it to the group so all of you can see it. And inshallah, if we have time, next presentation, we can just give you comment for that. Okay? Who will be assigned for that? For Oski?
I can, Doctor.
Okay.
Okay.
So am I clear? You need some pictures about diagnosis. If you have one table about the most common congenital anomalies and the accompanied heart disease, you need to make some abnormal shape of the chest X-ray which matched with congenital heart disease. For this fellow tetralogy, you need to tell us if there is one draw, why hypercyanotic spills come and how can we help it to go with this maneuver, knee chest position. Okay?
Doctor, so
Yes.
for the OSCE, I need to prepare the variety of the chest X-ray that shows the congenital heart disease, presentation of
Yes.
the congenital heart disease, and
Yes.
also I need to prepare slide for how the knee chest maneuver can inhibit the hypercyanotic spell.
Yes, and
Or
some general pictures of the common syndrome, like one patient with Down, one patient with. You can ask help of other colleagues with you to do this. One patient of Marfan, one patient with Turner, one patient with Noonan syndrome. All this, because if you remember a basic, you can build over it. Okay, you will not start from 0 point after that. Okay.
Doctor, I have a question. If I'm not mistaken, I've read Nelson. In the Nelson, it mentioned that for the syndromic features, it will present with so many congenital heart disease. So which one should I take to be my to be prioritized? I should prioritize that congenital heart disease.
Which one is what? What's your question again?
My question is, in the Nelson, it only mentioned that for Down syndrome, the most common congenital heart disease is AVSD.
Yes.
For the other syndromic features, if I'm not mistaken, the congenital heart disease, there's a lot. So which one should I choose?
The first one or two. First two is enough.
Okay.
Of course, it is like descending gradient, even the first two. Okay.
Okay.
And you need to share it to me and to the group, inshallah. And it may be also included to Hidayat to put it in the video. Okay.
Okay. Thank you.
Okay. Any question, please? No more questions, so we can start our second presentation, please.
Doctor, how do you want to do the second presentation? Is it just like just now by simulator, or I just present the case?
Yes. No, you must do simulation.
Okay.
It is our chance now to big point which make normal practice. Usually you are getting the history. I know speaking by Malay, and most of the family are knowing the case and give you the details, and you can open the book. But now you can choose one of your colleagues who will raise his hands or her hands or I will assign. It is a matter of few seconds and all of you can be. So who will be the second couple? You, Fariha.
Yes.
Okay, my mom is waiting for another one to get the history of her baby. Who will be the one? It looks I will select again. أمل سعد. لا أكمل سعد.
Yes, sir.
Okay, أكمل.
Okay.
Please, everyone switch off his microphone, and you need to increase the volume, so no problem about that. Okay. You have 20 to 25 minutes maximum, please.
Okay. May I start?
Yes, you may start.
Okay. Okay. May I know why you want to bring your child here?
So I came to the hospital.
Sorry. First, you must introduce yourself
Okay.
and ask permission. You must our job must be decent and soft touch and okay. Don't be rushed even if you have hundreds of patients. Hi, good morning. I am blah blah, like that. Okay.
Okay. Assalamualaikum. My name is Akmal. I am a medical student from your A, and I would like to ask, may I ask about your child condition?
Yeah, I came to the hospital with my son because he has there is abnormal movement with my son.
When did the abnormal movement occur?
It occurred at 9 p.m. at night. Last night.
Okay. Before that, may I know your child's age and she or he?
My son, he is 1 year and 3 months old.
1 year, 3 months old. Okay. Can you describe more about the abnormal movement?
Well, on before 9 p.m. at night, he suddenly has had a abnormal movement, like his body become stiff, and there is some jerking movement of his limb, and when the abnormal movement occur, he lose consciousness. He lose consciousness for about 15 minutes.
Okay. Did the all four limbs was involved,
Yes,
or
yes, all 4 limbs involved.
is there any drooling of saliva, uprolling of eyeballs?
No, there's no any drooling of saliva, uprolling of the eyeball, or any clenching of the teeth. No, or any urinary incontinence. No.
Okay. For how long the abnormal jerky movement occur?
It's occur for about 15 minutes.
15.
Yes, 15 minutes.
Together with loss of consciousness.
Yes.
Okay.
And after that, he gained consciousness and he looked fatigued and sleepy. He's also unresponsive when I tried to wake him up.
What did your child doing before the onset of the seizure? Of the abdomen?
He was sleeping.
Oh, they were sleeping. Okay. Is there any fever?
There's no fever. No fever.
Is this the first episode, or there was a previous episode before this?
This is the second episode. The first one occurred when he was 4 months old, and at that time, he was having the same similar presentation, and was hospitalized for 1 month. And then there's no similar episode until this current one.
Okay. Did your child experience any vomiting, vomiting, or any neck stiffness, or other
Yeah,
abnormal movement?
neck stiffness. There is neck stiffness. Other than that, there is stiffness of 4 of his limbs.
So before you bring the child to the hospital, does the episode only one episode, or has taken?
The episode occur again when I reached the hospital upon arrival at the emergency department. The episode occur again, but this time together with drooling of the saliva and also urinary incontinence. That is both additional episode presentation. However, this episode only lasts for 2 to 3 minutes.
2 to 3 minutes.
Yes.
So at home, what was your how you deal with your child during the episode? During the
I was panicked. I was panicked and I tried to wake him up. However, my husband calmed me down, and then we quickly brought him to the hospital.
Okay. Okay. So I want to ask about the birth history. Okay. During the antenatal period, is there any complication, or during the follow up during pregnancy, is there any abnormal finding on follow up?
There was no abnormal finding. I followed all the antenatal checkup and no other medical condition that I have.
So during birth, is there any complication, or any problem arise?
My son was born preterm at 34 weeks via emergency lower segment cesarean. And at that time, his birth weight was 2.2 kilogram.
Is there any complication?
Um, during the labor, there is only prolonged stage of labor at that time. Other than that, no.
So after giving birth, did the child had been admitted before?
After birth, my son was comatose. So he was intubated and was put on ventilator for 4 days, and then was admitted to an ICU and discharged after 22 days later.
May I know why the doctor admit your child in NICU?
Because the doctor want to follow up the patient more since after birth, the doctor did CT scan and MRI, and the result revealed that my son has hypoxic HIE, hypoxic ischemic encephalopathy, and hypoxic ischemic encephalopathy second stage with head injury. So the doctor want to further check, monitor my son.
Oh, so this mean after birth, the child has problem with breathing, or just he can he tak apa.
I don't know, but the doctor said that there is a brain injury and there is reduce in the blood flow to the brain and cause ischemia to my brain side. And then that's all. Anything else? Akmal lost connection ke?
Tak mau macam ni. Sorry. Can you hear me?
Yes.
Okay, sorry the connection problem. Okay. Okay. Uh, after discharge from hospital, is there any problem with your child about the growth and development milestone?
Up to his current age, there is developmental delay. At his current age, he still could not stand up independently. He still could not walking and could not crawling. He needed to be pulled to sit and also in need of support when sitting. The child also could not attain his head control and still could not roll over from supine to prone position and vice versa. Other than that, he still could not grasp onto small object and still could not understand simple words or instruction and do not respond if his name being called.
Okay, after discharge from the NICU, did the doctor say about your child problem? Is there any the certain medical term that the doctor told?
About medical chart, no, but I noticed he looks kinda like failure to thrive, but I'm not sure.
Okay. So along this period, did you bring your child to the physiotherapy to to rehabilitate the condition about the development and growth delay?
Yes, I did. Uh, uh, Starting at 6 months, 6 months old, the doctor started to follow his growth.
Is it the first child or
He is the only child.
the only child? Okay. Hmm. So so between you and your husband, uh, uh, uh,
I'm sorry, I could
do
not
you have
catch
any
up.
relation with your husband before this? Tak dengar.
Oh.
Okay. Is there any other family member that with similar problem?
No.
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 So do you have any relationship with your husband before this? Is your husband your cousin?
No.
No. Um, where do you live? Where do you?
I live at Alur Gajah, Melaka.
Kalau Gajah Maka. So is there any financial problem?
No.
Or
All of the basic needs enough.
um, do you have any feeding difficulty?
Excuse me?
Do you have any feeding difficulty?
Yes. I noticed since he was born, he has difficulty in suckling
Problem?
and problem with breastfeeding. So so the doctor suggests that he was feed with breast milk through bottle. The doctor said there is problem with his suckling reflex.
For now, he can feed himself.
No, he still could not feed himself. He only drink milk, and sometimes it's a soft food like cereal. He could not chew on any hard food.
Okay, so before so in normal situation, do your child appear abnormal, like macam
His posture or
his about his posture.
I noticed there is abnormal posture with his lower limb, like it become cross or like cross leg. And also the foot, his foot, it's like in, can I use medical term here? It's like in dorsiflex and also inverted. It's like this. Anything else?
Sorry,
Anything else?
about the cross leg, cross leg at all time or certain time only?
When we try to pull him up and make him walk, then the cross leg appear more obvious. Kesiannya kau. My lost connection lagi. Hello student.
Hello, sorry. Sorry, can you hear me?
Yes.
Okay. So by this time, can he walk by himself or?
No, he still could not walk, could not crawling, could not roll over.
Um, so about this, his current medication, what the doctor gave him?
He only currently he only take a syrup, baclofen. No, syrup, sodium valproate for his seizure.
Syrup, sorry.
Syrup, sodium valproate.
Okay. How frequent that the mother give him?
Twice daily if I'm not sure, but twice daily.
Twice daily.
Actually, I'm not sure.
Does your child any respiratory symptoms such as cough, noisy breathing,
No.
fast breathing? No.
No.
Did he experience any vomiting, diarrhea, constipation?
Constipation, yes.
For how long?
Sometimes. About 2 days because he is having with a feeding problem. So sometimes.
Um, Is there any trauma to the head before?
No, there's no trauma.
Trauma to the head.
Remaining 2 minutes.
2 minutes.
2 minutes.
Okay, may I know what is your, what is your opinion, what is your idea about your child condition?
About my child condition,
Yes.
what kind of idea?
What is your, okay, never mind.
Sorry, tak faham. I do not understand.
Yeah, I think that's all.
Okay.
Thank you, Fran, for spending time so that I can ask the question about your child.
Okay, you're welcome.
Okay, that's all.
Okay. So Fariha,
Yes.
what is the diagnosis of your patient?
This child is having spastic quadriplegia cerebral palsy.
And what is the presentation?
The presentation is developmental delay with poor feeding, with seizure, and also development of sudden jerky movement with loss of consciousness, drooling of saliva, and urinary incontinence.
So
Other
what
than
is
that, based on the question just now, he also has abnormal posture with stiffness of all 4 limbs.
So this fits or convulsion, what is the diagnosis for it?
Differential diagnosis. First might be vascular. First might be infection such as meningitis or encephalitis because he's having seizure. Next might be vascular malformation because there is similar in upper motor neuron lesion. Other than that, might be trauma. Next is metabolic disease. For example, if there is any inborn error metabolism during at birth. Other than that, idiopathic epilepsy with quadriplegia cerebral palsy.
So Akmal,
Yes.
what is the definition of epilepsy?
Unprovoked seizure.
Very good, but it is recurrent because we are not able to diagnose epilepsy if only single attack, unless there is some criteria. Okay, so repeated unprovoked. What is the meaning of unprovoked here?
No triggering factor.
Like
Like the light.
Lights, okay.
The light and also sounds.
Okay.
Okay. Fever, infection.
Very good. So now we need to put some titles which most of you must know. But I think today first lesson is try to be ready, please. All of you must be ready every time to get a history, to examine a patient, to comment, to make differential diagnosis, because this is a permanent job of us. always they said in Arabic العلم في الراس مش في الكراس. They mean the knowledge must be in the brain, not in the book. Our role is try to retrieve, copy paste, and put some knowledge, essential one, of course, to put in our mind. So we are not dependent on the book. We have our own computer inside our mind, which you can process rapidly. At least if you need to search, you need what is the point you need to complete. Okay. Number one, what is febrile convulsion? Who can answer? New candidate.
Febrile convulsion is a seizure that accompanied by fever in the absence of intracranial pathology such as meningitis, encephalitis.
So in the absence of intracranial infection or other pathology. Very good. So how many types?
There are two types, simple seizure and complex seizure.
Okay, now if a role player from you will ask him few questions about febrile convulsion. It may be Afik, Shami.
Yes, doctor.
Just your colleague now speaking about febrile convulsion. I need you to ask him as if you are one of the family member and asking him few questions, please.
Okay. So my name, Assalamualaikum warahmatullahi wabarakatuh. My name is Mama Afishami bin Mama Yusuf. I am a third year student from IUMs. Then can I know your name?
My name. My name
Opo.
is Nur.
Yeah.
My name.
Yes.
Okay. My name is Nurul.
Nurul. So you came to the hospital with your son or daughter?
With my son.
With my son. So how old is he?
Again?
How old is he?
He is 1 month, at 1 year and 3 months old.
1 year 3 months old. So
I need you to counsel her, to tell her what is febrile convulsion and its types and like that.
Oh, I need to tell
Yes.
About the febrile convulsion.
Yes.
Okay. So okay, I will explain to you about febrile convulsion. So do you know what can I know what do you know about febrile convulsion?
Very good.
No. No, I don't know.
What do you mean? Do you know a little bit about it, or you don't know?
Usually the seizure is precipitated by fever or infection.
Fever or infection. So I will explain about you about febrile convulsion. So firstly, febrile convulsion is a type of is usually a type of it happen when your son or daughter have seizure in presence of fever usually. So it is so if your son still have fever, it is said that 30% your child will be you will 30% of there is 30% chance that your child will have recurrent seizure. So do you want to ask anything about seizure?
Mm, um, uh, uh, about the seizure, is it possible that every time my son is having a fever, then he will come with seizure? Or if there is any certain condition like based on certain microorganism or type of infection?
Yeah.
The seizure.
If you usually febrile seizure can triggered by infectious organism. For example, if your child have concurrent upper respiratory tract infection and then and other infection, your child might have another episode of seizures. And then is it any other question you want to ask, or
No.
So I want to give an advice. So when your child has a seizure, firstly you don't have to be panic, and then second, don't do anything to the child. For example, insert something in your child's mouth or anything, because that can exacerbate your child that can exacerbate this
Worsen my conditions, my son's condition.
worsen your child's condition. And then it is best to put him in neutral position, which is in lateral position, so that because if you put your child in supine position, the tongue will obstruct your son's airway. So it is best to put him in lateral position, so that the air can flow into your son's respiratory airways. And then please call the or go to the nearest clinic as fast as possible, because it is an emergency situation. And then that's all. That's all. So do you have any other question?
No, thank you for the advice.
Okay. That's all.
Okay, thank you. Yeah, you did a good job. In this part, you need to be a bit sympathize with the patient. Remember that I know. Hello?
Yes, Doctor.
Yes, Doctor.
I can hear.
Hello?
Yes, Doctor.
What happens? I don't know.
Yeah.
You can hear me now?
Yes, yes, Doctor.
Yes, Doctor. Yes, Doctor.
Meet and chat. Hello? Hello?
Yes, Doctor.
Yes, Doctor.
Yes, Doctor.
I don't know what this is. Something happened. Save driving mode. I am not driving. Your video is stopped. Your microphone is unmuted. Hello?
Yes.
Yes,
We
okay,
cannot see you, but
okay,
we can hear you.
okay, good. So the most important point is to be sympathize to the one. Get that anyone with a medical condition is considered in a weak point, and you must be rahim or sympathize. Allah said for the Prophet Umar, "Arsalnaka illa rahmatan lil alamin." So we need to give the patient knowledge. Yes, it's our rule, but must be introduce yourself as you do and try to sorry for your baby got convulsion. I am here just to uh, discuss with you the convulsion and give you some advices and try to tell her many times so sorry because it is very important to sympathize. Good to ask about the patient knowledge. Okay, but even when you are going to give any bad knowledge uh, or bad news, please try to put something good beside it. Okay. Also, don't rush to give the numbers. I know you can give it in the second bolus. Uh, can you hear me? Hello?
Yes, yes.
Yes,
Yes,
doctor.
sir.
Yes, you can.
To try to give the patient something like to tell her yes. That's why I am sitting to discuss with you that point. Any patient he can get fever from any type of infection, whatever the cause of the fever, because the brain is easily excited. So if the temperature spikes this rapidly, the patient may start to startle and convulse. That's why I'm advising you, you must keep antibiotic at home. We must keep two types, one syrup, one suppository. And sometimes if the attack is very severe, we can give you at home like uh, diazepam suppository, which is anticonvulsant, can be given while you are on the way to the hospital, okay, or waiting for the ambulance if you feel that your baby is not safe. For all this is a matter of education. And if you educate the patient, you make a very good job because it is your job to educate. Okay. Uh, hello.
Yes,
Yes,
doctor.
Yes, doctor.
Yes,
Well,
we can hear you,
Yes.
doctor.
So yes, please. So your job, please, is try to educate the patient in because it is not good. If number, if you try, yeah, it can happen. So if the patient asked you, what is the percentages, you can go for percentages after the first attack. It may be higher, like 70 or like that. After the second attack, it can be less. So you must be able to give a message and give her, if you present any problem, try to put something good beside it. We are going to give you medication, we are going to teach you, and you must have emergency number for ambulance or like that. Okay. Other question I need you to answer about, please. What is the ABC for treatment of fits? If any patient have convulsion, we have A, B, C, D, E. So what is this?
A, secure the airway.
Okay.
B, B. Can someone help me? I forgot.
Breathing.
Breathing.
Breathing. Okay. C
Okay.
for circulation.
Hmm.
I forgot.
Okay. D for D. It may be 3D, not 1D. So the first D is the dextrose. It is very important for any convulsing child to do bedside test is the dextrose. Okay, because hypoglycemia can cause even status epilepticus, and this is our next. You can consider it like take home message to study it. I don't want to say it is homework. Take home message to study it, please. Okay, status epilepticus. What is the definition of status epilepticus? What is the treatment? It is very important. You have a very nice protocol, our pediatric protocol. It contains very important tables which will guide you. Okay, treatment of status epilepticus. At least you must know the general lines. Okay, but if we are going to resuscitate the baby, so number one, I must secure the airway. Okay, prevent aspiration or suffocation, and breathing, and then come for circulation, which is evidenced by the other vital signs like the pulse and the blood pressure and capillary refill time and blah blah. And D, which is number one, is dextrose. Okay, number two is the disclosure. Okay, I mean by disclosure, if there is skin rash. Okay, is there any relation between skin rash and convulsion?
Meningococcal.
Yes, very good. So meningococcal meningitis, okay, it's very, very important because it will be presented by
Purpuric rash.
berberic rash. How can I know is it berberic? Berbera is
Non-blanching.
non-blanching. It is very important. So please, in your medical practice, if you found the non-blanching berberic rash, don't bypass it. It is very dangerous. Okay, you must know what is the cause behind. Is it like idiopathic thrombocytopenic berbera, or it is severe, which can be life-threatening like meningococcal meningitis? So it is very important. Okay. Also, there is a group of diseases which you need to make it for our case of convulsion, known as neurocutaneous syndromes. Anyone knows example for neurocutaneous syndrome? Hello?
I don't know that there.
Neurofibroma?
Very good. Neurofibromatosis. What is the relation between the brain and the skin? Both of them are generated from ectoderm. You got it during your anatomy and embryology before. That is to say, we have about 9 or 10 diseases known as neurocutaneous syndrome. One of the most famous is neurofibromatosis. There is one with Bortwine stain. There is another one. So we have a lot of diseases. Okay, you must know at least one or two of this. Okay, so it is the most important to concentrate. Is there any skin rash, or is there any skin stigmata? Okay, it is very important. And the 3D is the disability. I mean by the disability, if the patient has like neurological problem, he looks hemiplegic or paraplegic or whatever. Okay, that's to say, EBC, suppose you will got soon what is this basic life support, but remember that please, for any case of convulsion, don't miss to check the dextrose, the disability, the disclosure for any rash. Okay. The third point which you must go through today, not tomorrow, inshallah, is the cerebral palsy. Okay. Cerebral palsy have a lot of details. Okay. But you must be able to define the type of cerebral palsy and what is the part of developmental delay, what is the definition of global developmental delay. Okay, it is very important, please. I would like now to ask again Akmal and Fariha, what investigation you will consider for this patient?
After birth, usually we proceed with thyroid function test. If there is any abnormality, such as it causes abnormal in muscle tone or tendon, and then do chromosomal analysis, such as karyotyping or chromosomal microarray, or any specific DNA testing. For imaging, we can do mostly MRI if there is any brain damage. Other than that, because there is presentation of seizure, we can do electroencephalography.
Good. Kita keluar.
Itu tak ada.
Okay, Akmal.
Proceed.
Hello?
Yes, doctor.
Okay, so sorry, I don't know, maybe something related to internet here in Clanton. Okay, just, yes, continue, please, your answer. Fariha?
Okay, first, I would like to do the thyroid function test after birth to look for any abnormalities in the muscle tone or tendon, and then do the chromosomal analysis, such as karyotyping or chromosomal microarray, to look for any genetic syndrome or possible dysmorphic features. And then for imaging, I would like to proceed with MRI to look for evidence of brain injury. And then because he has presentation of seizure, and also to evaluate the HIE or hypoxic ischemic encephalopathy, do the electroencephalography.
Okay, good. Beside that, Akmal,
Yes,
do you need to add anything, Akmal?
Maybe to exclude other causes.
Yes, very good.
causes.
This is a most important point. Yes.
We can do full blood count to look for leukocytosis. Then more invasive procedure, we can do lumbar puncture to detect any sign of meningitis. So then, okay, that's all.
So yes, you got the point, and this is very important. But we must be able to say, I would like to do like septic profile, okay, which may include full blood count, searching for, as you said, maybe leukocytosis. But you must say to differentiate bacterial or viral or other. So you must be able to neutrophil for bacteria, lymphocyte for viral, monocyte can be for atypical, like that, okay? Also, I'm going to look for anemia, because sometimes anemia can precipitate any condition, okay? Platelet, especially if there is non-blanching rash, because it may be clue for thrombocytopenia. I may consider inflammatory marker like CRP or procalcitonin, BCT, okay, which is very important for defining of diagnosis. Maybe also ESR if needed. Imaging I may consider, but in the acute condition, we are not in need of MRI, but if you suspect like trauma, like that, I'm going to do that. The same situation, if I suspect meningitis, if I rule out increased intracranial pressure, either clinically or by radiology, because with time after closing the anterior fontanelle, you must make sure that there is no severe increase in the pressure. Okay, I may proceed for lumbar puncture. You must know searching for white count. Okay, searching for dextrose, whatever. So you have knowledge. You must be able to present it. Okay. The most important point here is stabilization for the patient. Once the patient came to me in the emergency department, I will say, if you are the head of the team, I am going to insert big line, I mean big size cannula. Even sometimes I need to insert twice because it may be need further medication. I will ask of one of my colleague to of the staff to collect a big sample for inflammatory marker, for dextrose, for blood gas, okay, like that. And if I able to assign someone to get the history from the mom to tell me anything behind that. So this is the same, which will happen with you just after short time. So always when you are discussing patient, as if you are in the clinic or in the emergency department and you find the patient coming to you, you don't know what will come. That's why I try to make it like natural, one today. You will not say, I am sitting today in the clinic or emergency, I will accept only tonsillitis and common cold. Cannot be. Okay, unpredictable one is convulsing, and really the patient sometimes came in clusters. If one patient is sick, you will find 100 patients coming after him. So please be prepared, be strong for that. Today we touched many points. I think you need to consider it because I have another session just to pray Maghrib. Now it is your turn if you need to ask any questions.
Yeah, Doctor.
Yes.
No, Doctor. No
No.
question.
So who will be the one responsible for doing OSCE for us for the CNS case, which includes cerebral palsy, which include meningitis, which include positioning of the patient, like that.
Me, Doctor.
Okay. So please prepare for 2 OSCE and share it in the group, inshallah. Okay. Next time, inshallah, it must be prepared a new colleague. Today we are discussing about 4 colleagues. The remaining 6, it will be 2 colleagues as a role player. We'll give them all the knowledge. Okay. The other one is the OSCE. We will give them all the knowledge for diagnosis and differential diagnosis. Maybe knowledge about diagnosis and differential diagnosis, so they can support us by looks like real situation. The third one, he is a doctor who is choosing blindly. He doesn't know anything. Maybe if you need to tell him, you can tell him the system, not more. We are going to examine you in cardiology or in neurology. Just if he need to prepare himself, he can prepare, but don't tell him the full diagnosis, please. That is the actual thing. Okay. Thank you.
Okay, Doctor.
Okay, Doctor.
Thank you,
Thank
Doctor.
you. And
Okay,
see you
Doctor.
soon.
Thank you, Doctor.
Assalamu alaikum.
Waalaikumsalam. Thank you, Doctor.
Welcome.
Thank you, Doctor.
Thank you, Doctor.
Bye. Bye. See you inshallah again.
See you, Doctor.
Thank you.
Boleh, Dek?
Terciduk bahang.
Pecah kepala je.
Dua kali kes seizure, bye.
Gila bang.
Tiba-tiba dia tak cakap apa pun, kena buat roleplay apa.
Chat, betul kan Chat aku cakap? Tak ya.
Tak ada. Okay lah, aku nak
Alright.
Maya,
Alright,
Maya.
guys. Maya kan, Maya.
Okay, Assalamualaikum.
Bye. Assalamualaikum.